Well, it's meant to be a time of joy and celebration, but for the second year in a row, the coronavirus pandemic is derailing the holiday season. Will new restrictions across Europe stop another deadly wave of COVID-19? I'm Andrea Sankey, and today's Newsmaker is another COVID Christmas. Well, the week before Christmas and all through the land, politicians advise us to cancel our plans. At a time when all of us were hoping the pandemic would be a memory from a Christmas past, scientists say the Omicron variant is surging at a speed unlike anything we've seen before. So now millions of people around the world are again spending the holiday season with COVID restrictions or even under lockdown. As the World Health Organization chief put it, postponing a party is better than planning a funeral.
An event cancelled is better than a life cancelled. It's better to cancel now and celebrate later than to celebrate now and grieve later.
Well, the WHO is warning that a COVID storm is battering Europe and countries need to brace themselves. The Omicron variant has already become the dominant strain in the UK, Denmark, and Portugal. The Netherlands is in full lockdown. France has already banned British travelers. And even Sweden has tightened measures. Germany is limiting private gatherings after the 25th, as is Portugal, which is one of Europe's most vaccinated nations, and yet it's still seeing a rise in hospitalizations. It may be a time for goodwill toward men, but there's little of that left, it seems, for the UK government. Britons have been incensed by recent scandals where it emerged that politicians had held parties during previous lockdowns. And their anger may have been only slightly abated by Prime Minister Boris Johnson not cancelling Christmas altogether this year.
We continue to monitor Omicron very closely, and if the situation deteriorates, we will be ready to take action if needed. And what this means is that people can go ahead with their Christmas plans, but the situation remains finely balanced. And I would urge everyone to exercise caution, to keep protecting yourselves and your loved ones, especially the vulnerable, and remember to keep following the guidance.
And across the Atlantic, President Joe Biden will be giving Americans a belated Christmas present of sorts, making 500 million rapid tests available for free starting in January. The commander-in-chief is also deploying 1,000 extra military doctors and nurses to overstretched hospitals, and the U.S. has begun stockpiling medical equipment in preparation. Biden also pleaded with the 1 in 4 Americans who are still unvaccinated to get their shots, calling it their patriotic duty.
And again, to folks who are not vaccinated, you might think you're putting only yourself at risk, but it's your choice. Your choice is not just a choice about you. It affects other people. You're putting other people at risk. Your loved ones, your friends, neighbors, strangers you run into. And your choice can be the difference between life or death.
Meanwhile, the U.S. has been added to Israel's red list for the first time. Travel to and from the U.S. and Canada is now prohibited, along with more than 50 other countries declared off limits in an effort to contain the spread of Omicron. And that's as Israel begins administering 4th doses of the COVID vaccine. But the picture's rather different in Bethlehem, where both vaccines and visitors are highly sought after. The Palestinian city is believed to be the birthplace of Jesus. Back then, it was under Roman occupation. Today, it's in the Israeli-occupied West Bank, and it's the advent of the new variant that's making its presence felt today. The economy relies on an annual spike in visitors, and Palestinians have struggled throughout the pandemic with difficulty accessing medical supplies and protective equipment. Keeping with history, and it's worth remembering that this isn't the first Christmas that people have had to spend in isolation. In 1918, the U.S. was in the grip of the Spanish flu. There were warnings to avoid kissing under the mistletoe. And Ohio's state health commissioner recommended people postpone family gatherings until at least Easter or the 4th of July. At the time, influenza was killing people at a faster rate than the First World War, which preceded the outbreak. Well, back to 2021, and the new variant is clearly incredibly transmissible. But what impact will the wave of cases have on health systems and on our own health? Let's try to get some answers now. And joining me from London is Oksana Pyzik. She's a lecturer at the University College London School of Pharmacy. From San Francisco, we have Jake Glanville, the founder and CEO of Centivax. And from Pittsburgh is Dr. Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security and a specialist in infectious diseases. Thanks all so much for being with us. I'd like to start with the United States because, Americans have seen now over 800,000 lives lost, overburdened hospitals, yet so many are still highly averse to restrictions and lockdowns. Amesh, knowing that politicians are reluctant to get strict, how worried are you about what could happen in the next few months?
What's going to happen in the United States is more going to be a regional hospital problem, similar to what's happened with Delta. There are many hospitals in the country where there are low levels of vaccination in the communities that they serve, and they are going to get hit hard, just like they've been hit hard with Delta. And that's what the president's plan is about, is shoring up those hospitals. I think we aren't in a position that we were in March of 2020, as the president stated. We've got a lot more tools. The FDA approved the Pfizer antiviral. That's going to be something that helps us change the course of this pandemic. And I think we've got these precision-guided tools to help blunt the impact, but it is going to be an impact. We are going to see Omicron go through that unvaccinated population. And those who are unvaccinated and have high-risk conditions are going to impinge on hospitals. And we've got to really just shore up those hospitals, use the tools that we have, and remember that it's the vaccinated that are protected, that they're not going to be the ones taking up hospital beds. And we have to try and reach the unvaccinated and use all the tools at our disposal.
Okay. It's kind of a twofold question then off the back of that. I mean, what about the language that President Biden is using, really warning the unvaccinated and kind of saying it's their patriotic duty to get vaccinated? Is that, first of all, what needs to be said? And how much is there a component now of those unvaccinated people not feeling like they need to listen because those antivirals are about to hit the market, they think, soon anyway?
I do think it's important to point out to the unvaccinated that it's they who are holding us back, because it's they who are holding hospitals hostages. Because when you work in the hospital, and I work in the hospital all the time, it's unvaccinated COVID patients that are taking up ICU beds, hospital beds there. So when they say that they're not getting vaccinated and that's their business, that's fine. But then they come to a hospital and expect to be cared for, expect to get monoclonal antibodies. And all of that really has a major impact. What's happening when you're not vaccinated in the United States is you are actually crushing your own community hospitals. This is willful. So I think it's important to be stern with them, because this is something that they have caused by their own choice. And until that's sinks in and gets them to actually reconsider their position, I think we have to continue to do that. And at the same time, reassure the vaccinated people that this is something that they don't necessarily have to worry about in the same way. Mm. The antivirals are not a substitute for the vaccine. It's great that we have these antivirals. The Merck and the Pfizer antivirals have good data. The Pfizer has extremely good data. 90% protection against hospitalization and death, and that's why it was approved. I think this is going to be critical to keep people out of the hospital. But it's always better to not even be in a position where you need a treatment by getting vaccinated. When it comes to infectious diseases, prevention is always better than treatment.
Certainly. Jake, let me ask you, do we know yet how bad the Omicron variant really is? We heard we would need a few weeks, but it's been a few weeks. And the WHO is now saying that it's actually too soon to say if Omicron is even more transmissible than Delta, and that no country can use booster shots to overcome the pandemic. When will we know what it is and what to do about Omicron and this new wave?
So scientists will always tell you there's more to learn, and certainly this is still early since this virus has arisen. That said, studies now have come out, a number of them that give rise to the pretty clear observation that this is highly transmissible with respect to all the previous variants of concern that we've seen previously, and that's borne out just by the pace with which it is taking over cases in the United States and many other countries. Now, with respect to the severity of disease, there are some studies that suggest that it is more mild. And that's really the area where we continue to need to evaluate the rate of hospitalization and death that happen after these waves take place. Keep in mind, it takes 10 days before someone from getting sick goes to a hospital, around 23 days historically from when they start to die. So there's a lag when we start seeing about a number of new cases where we need to kind of watch and wait to find out how severe it looks. So far, there are some promising hints that this is less severe. That's being complicated a bit by different age groups that have been infected, younger folks on average in South Africa. And it does appear that the vaccines, although they don't really do much to stop you from getting infected, they do stop you from having severe disease and therefore avoid the crisis in the hospital. I will say that the vaccines are a critical component of making a population resistant from deteriorating to such extent that they reach a hospital. These medicines can serve to do that as well. The Pfizer Paxlovid, provided that it continues to be as efficacious as we think, and provided that enough doses can be created, that is another critical tool that serves it is not as good as a vaccine in that you have infections taking place and that person's walking around. But if it can serve as a prophylactic or a preventative on early exposure, it serves the same function of avoiding stacking up people in the hospital. So I'm very glad that we have those treatments as well. That's not to say we shouldn't encourage people to get vaccinated, but it is a tremendous additional layer avoiding the medical crisis that is caused by the coronavirus.
Okay. Let me ask you, though, Jake, quickly, when you hear the WHO chief say that no country can use booster shots to overcome the pandemic, he's clearly trying to tell wealthy countries, again, let's start getting the rest of the world vaccinated before we really think about issuing third and fourth shots. Do you think that's the right message? Because we're hearing from others that booster shots are absolutely necessary at this point, especially in the Northern Hemisphere.
Yeah, so my opinion is there's two different things going on here. One is the very reasonable concerns around equitable distribution of vaccines. So even though 2 shots aren't sufficient to provide enough antibodies to, we think, stop infection, it does appear that those people have more mild disease. So there could be an argument that it's better to spread more vaccines around to give some level of protection so people get sick, but they don't get that sick. The flip side is, yes, it does look like after a third booster shot, most of your antibodies aren't going to work again anymore from the vaccine to the novel coronavirus, Omicron. But with a third booster, you're elevating the amount of the antibodies you have left that still work. That does appear to provide some protection. Okay. What we're going to see is that was 1 month in. When we look at 3 months, 4 months, 5 months in, we're going to see waning of that response. What we really need are new generation of vaccines to address the new variants, and hopefully more broad spectrum vaccines, of which multiple groups, including my own, are working on.
Okay, Oksana, I can see you agree, but I want to ask you something, actually, that's more UK specific, because as a health professional yourself, I need to know what you thought when you heard about those Tory lockdown parties. Did it make you angry, and what do you think it means for public trust in the government at a time as crucial as this?
Well, it certainly doesn't restore faith in the government and in the decisions that hard decisions that are going to have to faced now, whether that's during Christmas, that Boris now is saying we're looking at the situation hour by hour, but Christmas will be safe. That does feel like a concession for the fact that the government has become extremely unpopular due to the fact that it appears one rule for everyone else and one rule for them. So I think it further undermines not just the government, but even the scientific community, which weren't involved with the parties, but through the government, the message is being delivered. So I think getting more people on board during this time is perhaps harder than at any other time in the pandemic, particularly with the political climate in the UK right now.
Right. I mean, it is bad in the UK. We're seeing cases break records, the case numbers every day. So in your opinion, what really is the smart thing to do this holiday season? How should people be conducting themselves, regardless of what the government guidance is at this point?
Well, we know that the health impact is exponentially worse the longer that we allow exponential growth to occur. Acting early is something that we have seen has been very effective, sometimes the hard way in the UK. So really, I think many people now have taken the chief medical officer's advice about prioritizing who they're going to spend time with to allow them to have to avoid getting the infection, given the fact, as you mentioned, there are more cases now, their record-breaking rate than we have seen in the UK previously. So people are now being more cautious about, in the lead up to the holiday, who they're going to see, what activities they're going to partake in, and that has affected businesses. So the business community now is saying, well, there's limited support from the government. They've received grants up to £6,000 available, but it's not the same package as when there's an official restrictions that are put in place. This has just been general guidance. So it's a difficult position on all sides.
Right. Amish, let me come back to you. And, back in the U.S., President Biden is also now promising 500 million at-home tests, but not actually before the holidays when people are planning to gather with their families and friends. Is that helpful?
It will be helpful when we get them, but not helpful now. And I think this is another failure to really optimize the use of these rapid at-home tests that we've been clamoring for since back in the Trump administration. And we've already seen shortages. We knew that this was going to be something that would be a problem. And I think that the idea that this was unpredictable, as the president stated, is wrong. It's actually false. We've been asking for these home tests for some time. And we know that people are trying to navigate a world with COVID-19 ever present, with a more contagious variant. They're trying to do it safely, and they need these home tests to do it. And it's just not feasible if they have to drive all around town looking for these home tests, which are basically on bare shelves in many drugstores. We needed this to be done a long time ago. I'm glad that they actually recognize the need for these and are going to ramp up production and use the Defense Production Act. But it's going to come too late for many people who are trying to get through this holiday season without getting infected or to make their gathering safer.
And Jake, let me ask you, how important really is testing at this point? Because there are some that argue, as I'm sure you're aware of, that all it does is, give an inflated idea of how dangerous the virus is. And what really matters is whether people are getting severe illness from the virus. The cases themselves don't count.
So first off, I agree with everything that was just said. The power of testing is that it enables you to early identify a new case. That means you can isolate faster. That means you can notify contacts faster. And if they can test as well, this provides a mechanism to dramatically reduce the outbreak at your work, in your home, with your friends. That is very powerful, particularly if you now have the capacity for these pills that could be offered as a post-exposure prophylaxis or a treatment. So it is testing measures is really what kept Ebola in Africa. And what we've had so far is not enough availability of rapid testing or contact tracing. It's difficult to do in the middle of a wave when there's so many cases. But at any point, it's helpful. And certainly when you're not in the middle of a wave, it provides us now mechanisms to identify where the cases are, slow them from spreading and contacting other individuals, and provide treatments to further limit the viremic, the amount of virus a person's making, and to reduce the chance of contacting others. This is powerful, and we've been underutilizing it.
What do you say, though, Jake, to the people who actually argue, it's good. It's good to get exposure. It might be good to actually get the virus because we're hearing Omicron doesn't cause as severe of illness, and we want to build up those antibodies in ourselves, even to work still toward herd immunity. And if we lock down or observe restrictions, we won't get that exposure to make ourselves stronger.
Sure. So there's two parts of this. One is that argument's been the case since the beginning of the pandemic. And the ridiculous aspect of that argument is that this virus is dramatically more likely to kill you or cause long-term disability, which is long COVID, which includes neurological problems, as well as endanger those around you. So those arguments, I think those arguments were based on frustration and despair or just denialism around the vaccine benefits. With respect to Omicron, you've heard those arguments come up again because there was early reports that Omicron was more mild. Again, of course, that would be wonderful if that's true, but we just don't have good enough data right now to say, yes, it's safe to let this flow throughout our populations and communities. Now, as we monitor, if it is indeed appear like a cold, that would be great. Yes, then this would serve as a de facto vaccine for those who are not being vaccinated. But right now, we're not sure that if we let that happen, is this going to cause a disastrous effect with respect to medical crisis, overwhelming hospitals, as we saw by early groups in 2020 who made initial decision to allow natural immunity, and then they reversed course quickly, as was observed in the UK when they realized that was an unsustainable policy.
So, Oksana, then walk us quickly through the dangers of still having so many unvaccinated people all around the world, and why it's not just a danger to them to be unvaccinated.
Again, I think this has been hinted at in terms of the pressure on hospitals, the fact that there are knock-on consequences when people become sick. It's not just about hospital beds, but it's also that the healthcare workers, if there's uncontrolled spread, you'll have a skeleton staff trying to deliver essential and urgent care. And we're even seeing that here in the UK now because the spread is happening so quickly. About 1 in 10 NHS workers is predicted to be off in the coming week with sickness. There's also long COVID, which was already mentioned, which then adds a long-term systems pressure as these individuals will require chronic support and further care throughout their lives potentially. And of course, then thirdly, we look at new variants. Well, we shouldn't just assume that Omicron is the worst that it can get. Certainly that this vaccine inequity leads to greater transmission, and the more that the virus has the opportunity to replicate, the more opportunity for variants to emerge, particularly in areas with, again, that are immunocompromised, et cetera. So we do have to really view this as a global problem, which the WHO has been calling for repeatedly. And I think, however, we also have to look at boosters at home, as well as ramped up supply, localized pharmaceutical manufacturers in countries that don't have at-home industries to help meet that need. We shouldn't be relying on a handful of companies to vaccinate the world.
Right. Amish, try if you can then to give us whatever upside might be possible. Is the virus, in essence, weakening at least somewhat enough so that there is an end in sight somewhere? And in the future, will we be just facing what we could consider an annual flu season? But that is more severe because the coronavirus is never really going to leave us. But we are getting to the point that this is a virus we will have to live with.
The goal has always been to tame the virus, to remove its ability to kill and to crush hospitals. But that's more a function of us, our immune systems getting used to the virus by being vaccinated, by getting exposed to it, as well as the tools that science and medicine give us, like the antivirals, like the monoclonal antibodies, like the rapid diagnostic tests to help us guide our behavior. All of that makes it a more manageable illness. Whether or not what's happening with Omicron is that if it's losing some of its virulence, I think remains to be seen. There definitely seems to be a signal in South Africa and Denmark that this doesn't seem to be as severe a wave as the Delta wave was. But whether that's extrapolable to all countries, how much it's impacted by prior immunity. Remember, South Africa had the Beta variant, which is similar to the Omicron variant, caused a lot of infections there. That remains to be seen. But it is the case that we are going to get better at dealing with COVID-19, that it will become a respiratory virus, that we understand how to risk navigate, and we get more and more tools to make it unable to cause the type of damage that it can cause. That's the fate. We just have to get there, and the best way to get there is getting more shots, particularly first and second doses, into people's arms, and getting people the ability to be tested and linked to care, like the new Pfizer antiviral, like monoclonal antibodies. That's how we get there, by really becoming smarter and letting our immune systems get the benefit of the vaccine.
Jake, do you think we'll get back to so-called normal in 2022?
Well, we'll get back to so-called normal, the new normal. Whether that happens in 2022 is a separate question. And again, that gets back to there's a lot of things we don't know about Omicron and new variants that could emerge. What we have to our advantage is we now have what was just described as this powerful technology stack, which gives us the ability to live in context of the coronavirus and make it less of a medical crisis and more of a manageable infectious disease. I think one of the things that hasn't, in my opinion, been discussed enough, there have been some nice studies just released and a number of groups working on, are more broad spectrum vaccine approaches. Now, this is important because we're already living multiple generations behind of the type of virus that's in the vaccine versus the type of virus you're exposed to. There are a lot of groups working on new technologies to make our vaccines much more effective and more resilient to new mutations of the virus. That's something we want to separate the portfolio items we have now to make policy, and we also need to have R&D, as you've seen over the last 2 years, have been very dramatic in our ability to rapidly activate new technologies. And that's one that I think needs to bear more attention because it'll make this virus as well as a number of other viruses more manageable.
Okay, Jake, I will have to give you the last word. I'd like to thank you, Oksana Pyzik and Amesh Adalja, so much for being with us on this edition of the Newsmakers, and to our viewers as well. Thanks for watching. Remember, you can follow us on Twitter at @_Newsmakers. Be sure to subscribe to our YouTube channel. But before we go, we will leave you with scenes of COVID Christmas from around the world and the hope that 2022 will see the end of this global pandemic. I'm Andrea Sankey. See you next time.